I think hospital design was one of her major contributions. She wrote articles for an architectural journal called The Builder. But obviously her emphasis on hygiene itself is very much part of contemporary practice as well as practice in the past. And her epidemiological survey work was incredibly impressive, using some of the latest techniques. She trained in mathematics and statistics, and she deployed those data analytic methods in creating the evidence base to justify the case for change.